The following module will explore the hallucinogen class of substances, sometimes referred to as psychedelics. These are typically consumed to distort perceptions of reality. While some drugs may produce hallucinogenic effects, substances classified here produce hallucinations as their primary effect. Plant-based hallucinogens such as peyote and psilocybin have historically been utilized in many cultures for ritual purposes. LSD and ketamine are chemical-based hallucinogens that result in similar psychological effects. These include distorted perceptions of reality, changing the way a person sees, hears, and feels about a situation. Hallucinations may involve seeing or hearing things that do not actually exist, or exaggerating normal sensory experiences such as seeing colors more brightly. The mood of the person consuming the drug, as well as the context they are in, will affect the physical and psychological effects produced by the drug. Typically, hallucinogens produce feelings of relaxation and mood swings. They can also increase the heart rate, cause nausea, and produce confusion and dizziness. Many hallucinogens have the potential to cause hallucinogen persisting perception disorder. This involves flashbacks and recurring memories or dreams of the original trip. This disorder has been reported to last days or even months after the last dosage. Lysergic acid diethylamide, otherwise known as LSD or acid, is a Schedule I drug with no currently accepted medical use, as well as a very high risk of dependence. LSD is a chemically produced substance that is odorless and colorless. It may be consumed as a liquid, but most commonly it's sold as small decorated squares of saturated paper or sugar cubes. A person on LSD will experience an increase in body temperature, heart rate, and blood pressure, as well as extremely dilated pupils, excessive perspiration, dry mouth, tremors, insomnia, and decreased appetite. Changes in perception occur within an hour of ingestion, affecting the person's perception of time, the shape and size of objects, body image, sensory experiences, and depth perception. Additionally, LSD impairs judgment and inhibitions, which may lead to increased risk-taking and incidents of injury. It also produces acute episodes of anxiety and depression. Psilocybin is a chemical obtained from certain types of fresh or dried mushrooms, sometimes referred to as magic mushrooms. It's classified as a Schedule I substance under the Controlled Substances Act, meaning that it has a high potential for abuse and no currently accepted medical use in the United States. It should be noted, however, that many clinical trials are underway to investigate the effects that psilocybin may have on treatment-resistant depression and PTSD. As an illicit substance, psilocybin is primarily consumed in the form of fresh or dried mushrooms. These are ingested orally, either chewed, brewed in tea, or mixed with other foods. The hallucinogenic effects of mushrooms reduce one's ability to discern fantasy from reality. Visual and auditory hallucinations are common, as are panic reactions. Higher doses may produce symptoms resembling psychosis. At this time, very little research exists on the long-term or chronic use of magic mushrooms. Ketamine, known colloquially as Special K, is a Schedule III substance under the Controlled Substances Act. It's primarily used as a short-acting anesthetic for humans and animals. The FDA recently approved ketamine use for treatment-resistant depression, only when prescribed by a medical professional. It also has the potential for dependence and is commonly misused as a club drug. Ketamine is referred to as a dissociative anesthetic because those who consume it experience severe pain relief, sensations of detachment from time and place, as well as dissociation from their physical body. Sensory perceptions are distorted, and hallucinations may cause the user to feel out of control. It can cause amnesia and render users immobile due to its extreme sedative effects, and it's often used to facilitate sexual assault. Ketamine is usually consumed in powder form, either in capsules or by snorting or smoking. In its liquid form, it may be placed under the tongue or mixed into drinks. Ketamine produces hallucinations, distorting perceptions of sight and sound, making the user feel disconnected and out of control. Other effects include agitation, depression, cognitive difficulties, as well as heart rate, blood pressure and pupil dilation increases, salivation, and muscle stiffness. Peyote is a small, spineless cactus that has been used broadly across cultures to induce trance-like states for spiritual practices. Mescaline, the active hallucinogenic compound in peyote, can be consumed by eating the plant or drying it out and making it into tea. Dried peyote or chemically synthesized mescaline can be placed in a gelatin capsule or smoked with tobacco or marijuana. Peyote use almost always results in hallucinations, altered perceptions of reality, space, time, body image, and other illusions. Both peyote and mescaline are classified as Schedule I by the Controlled Substances Act, with no medically accepted use in the US and a high potential for dependence.